morning. How are you?
Men and women whose eyelids sag or droop may decide to consult a plastic surgeon when they have a functional problem caused by drooping eyelids, or when they want a look that's more alert and refreshed. Eyelid surgery, technically known as blepharoplasty, is a delicate process by which excess fat, skin, and sometimes muscle are removed from the eyelids. Eyelid surgery can be performed alone or in conjunction with another facial procedure such as a brow lift or facelift. Most people who seek eyelid surgery are over 35 years old. The best candidates for surgery are healthy individuals who have realistic expectations about what the procedure can accomplish. It's important to understand that blepharoplasty alone will not remove wrinkles, lift your brow, or get rid of dark circles beneath the eyes. Eyelid surgery can, however, make you look refreshed and a bit younger. Sometimes, when the upper lids droop severely, the procedure provides a primary benefit of dramatically improving a patient's field of vision. In such cases, the operation may be covered by Medicare or private insurance. If the procedure is to be performed for reconstructive purposes, it is advisable to obtain written pre-authorization for the procedure from your insurance carrier prior to surgery. Prior to scheduling surgery, your plastic surgeon will take a complete medical history and may test your vision and your ability to produce tears. Some health problems can hamper the success of the surgery or make it too risky. It's important to let your plastic surgeon know if you have a history of health-related problems or allergies, especially a thyroid, cardiac, or circulatory disorder, allergies, or if you have a problem with your vision or tear ducts. Your surgeon is sensitive to the psychological aspect of plastic surgery and is trained to recognize underlying emotional problems. Therefore, you will be asked why you want the surgery and how you hope to look and feel afterward.
At work, people are constantly asking me if I'm tired or I'm not feeling well, even when I'm in a good mood, and I've had plenty of sleep. Also, I don't like the way my eyes make me look older than I feel.
Looking at your face, I can see a couple of things contributing to that tired look you describe. You appear to be lacking some muscle tone in your upper eyelids, and the skin on both your upper and lower lids is stretched somewhat. This is a very normal and common symptom of aging. On the other hand, it could be hereditary.
Do you recommend that I have both upper and lower eyelids done?
The choice is yours, of course, but I think you'll be happier with the results if upper and lower lids are involved. The change in appearance is more dramatic in some cases, less in others. You'll have a more alert, refreshed look. And to achieve that, I need to eliminate the extra skin and some fat on top and beneath your eyes.
Is this considered major surgery? Will I have to spend the night in the hospital?
The eye area is very delicate, yet eyelid surgery is a relatively straightforward procedure that can be performed in an office surgical facility. So, a hospital stay won't be needed. Now, blepharoplasty takes about 1 to 3 hours. Now, you must arrange for someone to drive you home after the procedure. Your eyesight will be temporarily affected and you'll be feeling a bit woozy from the anesthesia.
Will I be asleep during the operation?
If you have a local anesthetic, you'll be awake, but you'll be very relaxed and experience minimal discomfort. A local anesthetic numbs the area around your eyes, and you'll be sedated so that you're sleepy and comfortable. General anesthesia may be used in some cases, more often if the procedure is performed at the same time as a face or forehead lift.
Exactly what happens during the procedure?
When your doctor reviews the steps of eyelid surgery with you, feel free to ask any and all questions. Tell your surgeon about your concerns and make certain your surgeon fully explains anything you don't understand. Typically, the procedure begins with incisions made in the natural creases of the upper eyelids and just below the lashes in the lower lids. Each incision is as wide as your eyelid, but sometimes they extend into the outer corners of the eyes. After the incision, the surgeon removes the skin from the underlying fat and muscle. The surgeon trims away the excess skin and some of the superficial eyelid muscle, then removes some of the fat. Fine sutures are used to close the incisions. In some patients, a pocket of fat is the cause of puffiness in the lower eyelids. Some of these patients might have a transconjunctival blepharoplasty in which the incision is hidden inside the lower lid, and only fat is removed, no skin or muscle. Once all the incisions are closed, your surgeon will probably lubricate your eyes with ointment, and a cold compress will be applied. In some cases, a light temporary bandage may be used. You can expect to feel some soreness and tightness in your eyelids as the anesthesia wears off. Pain medication will help you stay comfortable. The final results of your surgery may not be truly visible for several weeks. In the first week after surgery, bruising and swelling will probably make you feel rather self-conscious and uncomfortable. Cold compresses can help reduce bruising and swelling. As you continue to heal, scars will fade and your fresh, youthful look will emerge and last for years.
Do you have any more questions? Or is there anything that's unclear?
Since I won't be spending any time in the hospital, do I need someone to take care of me at home after surgery?
You won't need a full-time nurse, but it's a good idea to get some help from a family member or friend for the first day or two after surgery, when your activity should be restricted to home. Now, I want you to keep your head elevated, especially while sleeping. And cold packs on your eyes will help keep the swelling and bruising to a minimum. The bruises tend to look their worst the first week after surgery, but then they'll start to fade, and the amount of bruising varies among patients. Your eyes may be rather dry and irritated, or you may find that you're tearing a lot. Some blepharoplasty patients also become rather sensitive to light for a while.
My job involves a lot of reading. I plan to take about a week and a half off of work after the surgery and do some work-related reading at home. Will I be able to read?
After about 2 or 3 days, most patients are able to watch TV or read for a while. But I don't want you to overdo it. It's best to gradually build up your reading time. Also, you won't be able to wear contact lenses until about 2 weeks after surgery. And even then, contacts may feel somewhat uncomfortable. So, make sure you have a good pair of prescription glasses to use. You'll also want some good quality sunglasses to wear outdoors. Now, the time you're planning to take off from work seems adequate. Your stitches will be out by then, and depending upon how quickly you heal, you may be able to use makeup to cover the bruising. We have illustrations to guide you in post-surgical makeup techniques that are advisable for both men and women. After about 3 weeks, you can probably resume your normal routine. But until then, you should avoid any type of activity that may raise your blood pressure, bending, lifting, or sports. And don't plan on drinking alcohol. Both strenuous exercise and drinking can cause fluid retention, which can impede healing. Most of the noticeable after effects of surgery should be gone within about 4 to 6 weeks. And the thin pink scars under your lids will be barely visible after about 6 months.
What about risks or complications of surgery?
Blepharoplasty is one of the safest and most common plastic surgery procedures when performed by a board-certified plastic surgeon. It's sometimes a little frightening for patients in the days immediately following surgery, when they may experience blurring or double vision. But vision problems usually disappear within a week. And while blindness has been reported, it's extremely rare. Now, there is a possibility that an infection will develop, but it's very uncommon. And you can reduce the chance of infection by not touching your eyes as they heal. A small percentage of patients, less than 5%, find that they have trouble closing their eyes when they want to sleep. And in some very rare cases, this condition's permanent. However, most patients are back to normal in a few months. Another very rare but potentially serious complication is ectropion, a pulling down of the lower lids that causes the white of the eye to show below the iris, or colored portion of your eye. This may correct itself, or require further surgery.
My neighbor had her eyelids done a few years ago, and she ended up with eyes that don't quite match. If you look closely, one eye is more open than the other. Is this a common result?
Oh, very common. Most people's eyes are asymmetrical to some degree. Now, this natural asymmetry may not be corrected with surgery, but surgery doesn't create the asymmetry. Keep in mind, no two patients have exactly the same experience.
How soon after the operation might I need touch-up surgery?
You can generally count on your results lasting at least 5 years, but for some patients, the results are permanent. A lot depends on the way your face ages. And so far, we haven't found a way to predict how quickly or significantly that will occur.
I know as soon as I walk out of this office, I'll think of something I forgot to ask you.
I believe you're a good candidate for eyelid surgery, but the decision must be your own. Read the information I gave you. But please feel free to call my office if you have any questions at all. I want you to feel completely comfortable with any decision you make. And if you do decide to proceed with the surgery, my nurse can help you schedule a preoperative examination.
Thank you, doctor.
This symbol designates surgeons who are members of the American Society of Plastic and Reconstructive Surgeons Incorporated. They are certified in the specialty of plastic surgery by the American Board of Plastic Surgery and are dedicated to the highest standards of patient welfare and surgical excellence.
To display the activities window, activate the record window.